is Ashley Smallwood. I am the Paramedic Program Director for the EMS Paramedic Program at Patrick and Henry Community College in Martinsville, Virginia. How do we use ReelDx in our program? Well, to give you a little bit of a backstory, right before pandemic happened, we were noticing that we were missing a few spots of assessments in our program, specifically like in pediatrics and some of the more critical care things. And of course, as you know, when pandemic happened, we got kicked out of the hospitals unceremoniously and really weren't allowed back until very recently. So during pandemic life, I don't even know where I came across ReelDx. I can't even tell you where I found it. I came across it, did some searching, found out how much it cost, and got approval for us to start using it in our program. So currently how we use it in our program is a couple of different ways. We will find exemplars of what we're talking about in the class that day on ReelDx. Not necessarily every class, but at least every couple of weeks, we'll find a couple of good exemplars, and we'll kind of work through that as a case study in class, kind of as a live case study. But the other thing we do even more often, and I do as an instructor, is I find ahead of time ReelDx cases that fit with what we're studying, for example, in pathophysiology and pharmacology, because those are two big courses I teach. And I will make some little case studies for them. They're not really that big. They're not that involved as far as the case study questions. And I link ReelDx into our learning management system. The student logs in under their account, they watch the video, they read the information. And of course, sometimes ReelDx puts in some extra stuff in there about the condition or whatever the patient has going on. And then they go into the just Word document that I built about the case study, and they answer some questions. And those questions aren't necessarily hugely involved. For example, I was just reading one I wrote the other day, and it asks about a patient was having some bradycardia. And then I asked them, would the patients on valsartan, as was listed in the case study, would this affect their bradycardia or not? Of course, the student has to know, well, no, it wouldn't, because this is how it works. And they have to write all this out. So that's currently how we're using it, as both kind of a live feed type thing. And then we also do some case studies that they're doing some asynchronously. Benefits that we have found from students using it, just simply access to patients that they wouldn't have access to. So for example, I can remember there's a really good case that I think it was shot overseas where a mother decided to treat her child with some herbal remedies. And I think the child comes in with a really, really low blood sugar. So normally we don't see that necessarily in our area. We certainly wouldn't get a chance to see it in a PICU or NICU or anything like that, because we're not allowed in those areas at post-pandemic. So it's been really nice to be able to have those specialties that normally we'd never be able to see this type of seizure associated with severe hypoglycemia, and really put it in perspective. So students have been able to see things they wouldn't necessarily see. They've been able to access things like ultrasounds. They've learned a little bit about those. They're learning about chest x-rays because they're getting to see those. They're learning how to read lab work because, again, they're getting to see that. So again, that's just been a big benefit. And then, interestingly, I love it. Students say, hey, you remember that case study you made us do in ReelDx? Well, guess what happened to me at my job the other day? We had blah, blah, blah. And I knew all about it because I had done that case study. How does ReelDx stand out from other virtual tools? I just simply think the realism of it. I mean, it's literally a real patient in a real field setting or real hospital setting or clinic setting. I mean, you can't get much more real than real. And then the other thing I like about it is it gives you the backstory. As EMS providers, and my students realize this too, we're often frustrated because we don't get the full picture. We take our patient in, we kind of have a feeling about what's going on, and then they just kind of disappear into the void. And we never know, well, what was their lab work? What was their x-ray like? What was that CAT scan? We don't usually know that. So it's kind of cool that ReelDx kind of has that full view of the patient. In some cases are more involved than others, of course. So that's what makes it stands out, is that realism, and then its ability to kind of show the full patient. And as a teacher, I can choose how deep I want to dig on this particular patient. I may not dig very much. There might be CAT scan stuff there and I just skip right by it. I really don't care. I'm focused more on the lab work for this particular patient. So that's how it is standing out. Advice I have for a program, first of all, it's effective. It works. It's a great tool to have in your tool belt. Speaking now to the accredited programs out there, this will make people perk up. We are a KHEP accredited paramedic program, and I'm also working for COA as a site visitor as well. It helps catch those areas that you will maybe not be able to catch because of where you are located. And I'm specifically thinking programs that are maybe more rural, or in the case of some of us right now, pandemic's just simply not letting you in the hospital, and they're not letting you have those clinical experiences. You can start to catch those when your accreditor comes to you and says, hey, how are you making sure your students have access to a certain number of pediatric experiences? You can add this to your tool belt for simulation. It's about as real as you can get, short of going to go pick up random children off the street and do assessments. It's pretty realistic. So it's a great tool to have in your tool belt. I think it's very affordable. Of course, our facility purchases the institutional license, and then we have instructor licenses, but it's very affordable for students too. Students don't give me any flack about their little payment that they have to make. We have a 2-year program here. So if they're enrolled for the full 2 years, they're going to make that payment twice. I don't get any fuss about it. I don't get anybody saying, I can't afford it. I don't get any pushback from that. So it's very reasonably priced. The price point seems to be good for what students get. So again, I've been very happy with ReelDx. I continue to explore it. I continue to watch different cases and like, oh, that's kind of neat. That's a different perspective on something. I can use this for this. I'm excited to see, again, new cases come up. I follow them on social media, watch when they have different cases presented. And some of them I'm like, yeah, okay, I'm not interested. And others I'm like, oh, that's really good. We can actually use that. So again, great tool to have in your tool belt. It's affordable. It's easy to use. The folks are easy to work with. And I think it's just a great option for those of us out here in healthcare education, particularly the EMS side.